Good morning, everyone, and thank you for joining us for Webinar Wednesdays with SMP. Our August hot topic has been on pharmacy and prescription drug fraud, so that's what we'll be discussing today. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs, and I'll be your host this morning. Our presenters today are Nathan Coughlin and Danielle Guillory, who are both community outreach specialists for our SMP programs. We will be taking questions at the end of the presentation today. There will also be a prize drawing at the end for those of you who registered for this webinar prior to 10:15 this morning, and the winner must be present to attend. Unfortunately, due to technical issues, our closed captioning is not going to be working for this live presentation this morning, but you can view the presentation later on our YouTube channel with closed captioning if you need it. Before we get started, I do have to let you know that this project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official Administration for Community Living policy. So who is Senior Medicare Patrol? Well, SMP is a grant-funded project by the Administration for Community Living. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, the SMP program is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. All right, so first up, we're going to do a poll real quick. We have a question for you. And our polling question is, do you have prescription drug coverage as part of your Medicare plan? So I'm going to launch that poll. And it should appear on your screen. And if you don't mind, let us know, do you have a prescription drug coverage as part of your Medicare plan? The options are yes, no, and I'm not on Medicare. And I'll give everyone just a few seconds to answer that question for us. Okay, so it looks like 22% have said yes, 11% said no, and 67% of you said that you are not on Medicare. And I'll share those results with you too. Well, thank you so much, everyone, for completing the poll. What we're going to do now is we're going to dive a little bit further into pharmacy and prescription drug fraud. And I'm going to turn things over to Nathan, who's going to get us started with today's presentation. Let's see, Nathan.
Good morning, everyone. Having a little bit of internet connection issues this morning. Hope everyone can hear me okay.
We're
going to talk a little bit about Medicare Part D. So what is Part D? Medicare prescription drug coverage, also known as Part D, is the part of Medicare that covers most outpatient prescription drugs. If you have a Medicare Advantage plan, your benefits could include prescription drug coverage as part of your plan. Medicare Part D is a separate insurance plan that is offered through private insurance companies for those enrolled in Original Medicare Parts A and B. The availability varies by state. These plans cover prescription medications for outpatient services. Most prescription drug plans charge a monthly fee that differs from plan to plan, and you pay this fee in addition to your Part B premium. Next slide. So we'll talk a little bit about pharmacy and prescription drug fraud. Pharmacy and prescription drug fraud is a consistent trend in Medicare. Criminals ranging from healthcare providers to drug trafficking organizations continue to commit prescription drug fraud because it is profitable. Unfortunately, there is a strong illegal market for prescription drugs. including controlled drugs such as opioids and expensive prescriptions. Next slide. So we're going to talk a little bit about the different types of prescription drug fraud that are out there. So one of the main kinds is a pharmacy intentionally provides you with less medication than you were prescribed. Additionally, a pharmacy issues expired medications. Or you are provided with and billed for an expensive compounded medication, including topical pain creams, when a traditional or less expensive prescription was ordered by your physician. Next slide. Here are a few more types of pharmacy and prescription drug fraud types. A company offers you free or discount prescription drugs without a treating physician's order and then bills Medicare. A pharmacy automatically refills a prescription you no longer need. You do not need to pick up the prescription, but the pharmacy still bills Medicare. An individual offers to pay for the use of your Medicare number to bill for prescription drugs or offers you cash or other compensation to pick up prescriptions on your behalf. Next slide. Medical identity theft could be another component to pharmacy and prescription drug fraud. You should always be wary if someone requests your Medicare number and other personal information to evaluate your prescription history at health fairs, senior centers, assisted living facilities, malls, farmers markets, home shows, parking lots outside of retail stores, or a privately sponsored wellness event. These venues are all high risk for medical identity theft. Medical identity theft occurs when someone steals or uses your Medicare number to submit fraudulent claims to Medicare without your authorization. Medical identity theft may disrupt your medical care and could result in financial harm. Next slide. You might be wondering how to spot pharmacy and/or prescription drug fraud. Here are a couple of ways. Be sure your doctor has assessed your condition before prescribing you any medication. Do not give out your Medicare number or other personal information to unknown individuals. Next slide. You want to always review your Medicare summary notice or explanation of benefits for the following. Prescription drugs, including refills that were never picked up, delivered, or even prescribed. Prescription drugs, occasionally controlled substances such as opioids that were prescribed by a healthcare provider you have never even seen. Amounts of prescription drugs beyond the quantity you were prescribed. A different prescription, often a more expensive drug than the one you originally prescribed, or a drug that is not approved by the U.S. Food and Drug Administration, also known as the FDA. Next slide. If you want to avoid becoming a victim of pharmacy and prescription drug fraud, or think you've been a victim, you should follow Senior Medicare Patrol's message, which is to protect, detect, and report. It's very important that you care about what is going on with your Medicare benefits. If you suspect pharmacy or prescription drug fraud, you must report it. Now that we've discussed pharmacy and prescription drug fraud, and you have learned how to identify potential scams, Danielle is going to share the 3 keys to success in preventing healthcare fraud, waste, and abuse. Danielle?
Good morning. Next slide, please. If you want to avoid becoming a victim of pharmacy or prescription drug fraud, or you think you've been a victim, you should follow Senior Medicare Patrol's message, which, as Nathan said, is to protect, detect, and report. You really want, where my stuff is. Okay, you really want to protect your information. Your personal information is your best defense against healthcare fraud and abuse. Let me give you some tips to help you remember when protecting yourself against Medicare fraud. First, treat your Medicare and your Social Security numbers like your credit cards. You never want to give this information and these numbers to strangers. Remember, Medicare will not call you and ask for your number. This is really important. Remember this. Medicare will never call and ask you for your Medicare number. Don't carry your Medicare card unless you'll need it for a doctor's appointment or other health care information such as x-rays or lab. Keep a record of your medical visits, tests, and procedures in a healthcare journal or on a calendar. Next slide. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Here are some tips to remember when detecting potential fraud, errors, and abuse. Review your Medicare summary notice or your explanation of benefits from your insurance company. Your Medicare summary notice, also known as an MSN, is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits or an EOB each time you have healthcare services. Compare your statements to your personal records and look for the following items: charges for something you didn't get, billing for the same services or supplies twice, services that weren't ordered by your physician. Next slide, please. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statements, call your healthcare provider or plan. If you aren't comfortable calling your provider or you aren't satisfied with the response that you receive, please call SMP. We are always here to help. Next slide. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. Next slide, please. As mentioned in previous slides, we have a toll-free number, 877-272-8720. And you can also visit our website, www.stopmedicarefraud.org, for additional information about our program. Additionally, we would like to encourage you to scan the QR code that is above using the camera on your cell phone. That will guide you to our social media platforms, including Facebook. Those are for Georgia, Louisiana, Mississippi, and our Spanish Facebook pages. We have YouTube and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcasts. Next slide.
Thank you. Thank you, Nathan and Danielle, for that great information on pharmacy and prescription drug fraud. Next month, we have another important and interesting topic on home health and hospice fraud. That is going to take place on September 28th at the same time, 10:30 a.m. And we'll meet to share additional information on home health and hospice. So we hope you'll be able to join us then. Just be on the lookout for an invitation in your mailbox, in your email inbox. All right, well, before we wrap up and open the floor for questions, we're going to go ahead and have that prize drawing for those of you who joined today. You'll just give me 1 second to launch the wheel. Here we go. And like we said earlier before we started, you do have to be present to win. So let's see. Good luck, everyone. Let's see, Mr. Bill Stick, is he on the call today? Okay, I'm not seeing his name, so we're gonna spin again. Miss Ann Nauman is our winner today, and I do see that she is on the call, so congratulations, Miss Ann. I will be reaching out to you later today with information on your prize from the prize drawing. Okay. Get back to the slides. All right, so before we wrap up for today, I'm going to go ahead and open up the floor for questions. If you have a question regarding the information we presented today, please raise your hand. If you look to the right of your screen, you'll see a control panel for GoToWebinar, and there should be a hand icon. And if you click on that hand icon, it'll raise your hand, and I'll be able to unmute your line and you can ask your question. So I'll give everyone just a second to locate that hand button if they have a question. It looks like Kevin has a question. Kevin, I'm going to unmute your line. You might be muted on your side, so you might have to unmute your phone as well. I think you're still muted, Kevin.
There should be a microphone button on the top right-hand side of your screen, Kevin, if you need to try to unmute yourself.
Yeah.
Okay, how's that?
There we go. We can hear you now.
Okay, good. I just had one question. Is Medicare active in reaching out to the pharmaceutical industry and the big drug makers regarding the exorbitant high prices of medicine, which also create to the theft and fraud problems that we're having with this, with the prescription drugs?
That's a good question, Kevin. Monique, do you have any insight into that?
I don't. I know that for usually any type of service that Medicare provides or covers, they usually have a set amount that they're going to pay for that particular service. I'm not sure if that's how it works with the prescription drugs. Like
Right.
if a provider wants to charge, let's say, $6,000 for oxygen, well, Medicare is not going to pay that. They already have a set amount that they're going to pay for that particular item. So I'm not sure if it works the same way with prescription drugs. And, I don't know if, they reach out to them and, talk about the high prices. I would think that they do because, of course, Medicare, doesn't want to pay no more than what they have to for medicines and, the services that they cover.
Yeah, I know that was a problem. That's becoming a big problem with a lot of the Medicare Advantage plans,
Mm-hmm.
how they're billing and overpricing some of the drugs. I'm not sure if they're marking it up or if that's the price they're getting quoted from the industry, from the manufacturers or what. But that's a big problem for seniors that have that Advantage plan as it relates to prescription drugs.
Okay. Well, what I'll do is reach out to our CMS liaison and see if she has any information on that.
Okay.
Okay.
Okay, great.
All right.
Thank you.
You're welcome.
All right, thank you, Kevin, for that question. It looks like Miss Ann has a question. Miss Ann, I've unmuted your line. You just have to unmute your phone so you can ask your question.
Okay, did that do it?
Yes, ma'am.
No. Oh, sorry, but I must be the last person in the world who doesn't use a cell phone. Is there any other access to all of this besides taking a picture with a cell phone or whatever?
Yes, ma'am, you would just have to enter the addresses or visit the Facebook page. What that QR code does is it brings you to what's called a link tree, which has just a list of all of the social media platforms that we have. So there's a list of, there's one that you can click on that will take you to our website, the www.stopmedicarefraud.org. And then there's a button that you can click that will take you to our Facebook pages. The only other way to access those is to do them independently through, through Facebook or through the internet.
I don't know how to do that either.
Yes, ma'am. Well, you know how to
Okay,
access
thank you.
the website. You're welcome. And let's see, we have a question from Shay.
Yes, good morning. How's everybody doing this morning?
Good morning.
Good. So we're able to also send it to her email if she does have an email address, if she wants to be able to do that portion.
Okay, that's good to know, Miss Ann. We'll send that to you, Shay. If you'll send that to me, that would be great, and I'll forward that to Miss Ann.
Awesome, will do.
Okay, thank you. All right, I'm not seeing any other hands raised, so that will conclude our presentation on pharmacy and prescription drug fraud for today. I do want to thank you all for joining us. I will send a follow-up email to you all later this afternoon with some more information about our program. And in that email will be a link to a short survey. And we would appreciate it if you would just take a couple of moments to complete the survey to let ACL know how we did today. And I also included it in the chat earlier before the presentation started in case you wanted to go ahead and access it now. All right, well, we appreciate you joining us this morning for our presentation on pharmacy and prescription drug fraud. And again, with the issue that we had this morning with closed captioning, the presentation will be available in recorded form on our YouTube channel later this afternoon, and you can access it through that and use the closed captioning there if you should need it. And that will conclude our presentation for this morning. So thank you all again for joining us. Thank you to our presenters, Nathan and Danielle, and we hope to see you all again very soon.